Hello and welcome to this episode of That's Interesting. I'm your host, Frank Hart. This show explores things that I find interesting. I hope that you find them interesting too. There are two guests on this episode, board certified specialist in stuttering, Adriana DiGrande, and my brother Don Hart of the Hart Speech Foundation is back in this episode, and we will explore the work of Ms. DiGrande. Welcome, Adriana and Don. Before we start, Don, please give us a brief explanation of the work done by the Hart Speech Foundation.
Thanks, Frank. I will be very brief. Basically, we started the foundation, as you know, 11 years ago, to help people that are severe stutterers to be able to get the help that they need to achieve more fluent speech. One of the ways that we do that is through the use of the program that Adriana DiGrande, who's your guest today, offers. We've had an opportunity to work with her for many, many years, and our relationship started probably close to 30 years ago when one of our children needed to go to her for help. And we were very successful through her program, and we want to be able to provide that opportunity to other folks so that they can attend the program. We provide scholarships because, as we talked in the last episode, insurance doesn't typically cover this type of service. So what insurance doesn't cover, we make up the difference for people.
That's good. Yep. Thanks, Don. Yeah. For those who are interested, the first episode of this show was totally dedicated to Don talking about the Hart Speech Foundation and the history of it, the current work, and future plans for it. So we're ready to get started with you, Adriana. So if you'd like to introduce yourself, a little bit about your background, your experience, and anything else you'd like to share with us.
Thank you. Before I begin, I would just like to thank Don and the Hart Speech Foundation. As he said, for over 11 years, the Hart Speech Foundation has been a godsend to children and adults who stutter. And without their support, they would not be able to access fluency therapy. So I thank Don Hart and the Speech Foundation from the bottom of my heart. So a little history about my training. During my undergraduate years, I was mentored by Dr. Charles Elliott, who had taught me so much about stuttering and about the person who stutters, which was very important to understand that. Immediately after my undergraduate program, I became certified in the Precision Fluency Shaping program, where I learned a great deal about treating the mechanics involved in stuttering, the speech mechanics. Following my master's program, I was recruited by the New England Rehabilitation Hospital to conduct their fluency program, where I treated people of all ages who stutter. And several years later, I began my own private practice, where I continue to treat children and adults who stutter exclusively. I have been a clinical supervisor at Emerson College and Boston University for several years. And I also presented workshops on stuttering in the United States and 3-day workshops in Italy, England, Switzerland, France, and Rotterdam. So it's been my life for the last 40 years, and I really love what I do.
We're glad you're doing it. You seem to have helped a lot of people, and we do appreciate it. The next thing I'd like to discuss is your program. Can you tell us about your program,
Yep.
the steps in it, and and how it works with the kids?
Sure. Do you think it would be important to just name some facts about stuttering?
Sure.
For example, so I thought we'd just learn a little bit about stuttering. About 1% of the world's population stutters. Approximately 3 million Americans here stutter as well. Stuttering generally begins in early childhood at the ages between 2 and 5. About 5% of the young children who stuttered early on will continue to stutter, and about 80% of those children recover naturally. So it's about 5% of children who begin continue. Stuttering tends to persistent stuttering in males, approximately 4-to-1 ratio. And the reality is we don't know what causes stuttering. But we do know that it's not caused by anxiety or psychological issues, nor is it a result of parent rearing. And you'll meet a couple who talks a little bit about their child, and we'll learn a lot from them as well. So stuttering in general is a disorder that impacts people on what I call a BET level: their behavior, the stuttering itself, their emotions, and their thoughts. Stuttering behaviors are involuntary, and they interrupt the flow of speech. So in my program, I deal with the overt behaviors. Those are the behaviors that I learned at the Institute in Virginia. And we talk about the emotional factors, the fear, the shame, frustration, all of those internal responses to being to dealing with stuttering and being a person who stutters. On a cognitive level, the person who stutters may develop negative beliefs about themselves, the listener, and speaking situations. So I thought this might be a good time to see some drawings, if we can. So I talked about the overt and covert behaviors involved in stuttering. And this was a diagram or a drawing that a teenager created to express his perceptions of his stuttering. So what we see here is all the tension associated with stuttering. In his case, he literally would bite his tongue when he stuttered. He felt tension in his vocal folds here, and all that frustration that occurs in the lives of people who stutter. This was another interesting drawing from a teenager who felt as if when he stuttered that there would be a blockage. And in his case, it was as if there was a plug in his mouth. You can see his eyes wide and the tension. Another feeling of someone strangling me. And stuttering really impacts the vocal folds. And when those vocal folds tense up, speech can't be produced. Their voicing can't be produced. So that's what this represents, is the tension in the larynx. And just the feeling of being held back from stuttering, can't move forward, can't say my words, can't say my names. It's not a sunny day every day. It's a lot of times cloudy for the person who stutters. This drawing was very interesting because it was that feeling that I can't speak, like someone else is holding me back, and that feeling like speaking is not possible. Same thing here. These were different drawings. None of these clients produced these drawings together. So this feeling, again, being trapped, being unable to say what you want to say. And here, these drawings now will demonstrate the listener and how people who stutter sometimes feel as if they're going to be shamed or do get shamed because of their stuttering. This feeling that I'm not part of the world, or I don't have access to what other people have because I stutter. This was a young man who was very bright, and he had all these goals for himself, and his stuttering shut that down. And he ended up becoming he ended up not going to college because he thought he wasn't good enough to attend college, smart enough. And this was one of the most touching drawings that I've had over all these years, is this feeling of shame, loneliness, Now, these behaviors occur not because these people are not healthy or are psychologically impaired. This is a natural issue related to the experience of being a person who stutters. And luckily, with therapy, a lot of these feelings change. And so that's why in my program, it's more of an integrated model, meaning I focus on the motor speech skills, which is very, very important, but also how the person thinks and feels about themselves, which is equally as important. Sometimes people stutter covertly, meaning they have all the emotions and feelings of a person who stutters, but they don't say what they want to say, they don't do what they want to do. They're still imprisoned, quote unquote, by their stuttering, but we as listeners may not hear them stutter because they change their words, and like I said earlier, they don't say what they want to say. So I thought these drawings really represent the kind of work I do and why I do that work. But I thought we would just do a little review. My program is an integrated model, meaning it deals with not only the physicality related to stuttering, the actual stuttering, but also how the person thinks and feels about themselves, the listener, and their stuttering. So we start out the program with identifying those moments of stuttering. We identify how they're thinking and feeling when they have moments of stuttering. And that's very important because we can't change a behavior if it's not identified. So we do a lot of talking about the experience of being a person who stutters. We then move into something called desensitization exercises. And we talk about holding on to a moment of stuttering until the stuttering tension decreases. I'll imitate that. So if a person stutters on baseball and it's, hi, I really love baseball, that's stuttering. When they're desensitizing themselves to the moment of stuttering, it'll sound something more like this. I really love baseball. So they take that tension and they stick with it. They stay with it, as opposed to trying to fight it and hide it and move forward when they can't move forward. So the freezing strategy takes a moment of stuttering, the person feels it, and then they begin to reduce that tension and then move forward. And that, I think, is one of the most important behaviors that I teach my clients. I also ask them to be open about their stuttering, another desensitization exercise. Let people acknowledge the fact that you stutter to other people. I have my clients make telephone calls to Starbucks or any other store and just say, hi, my name is Adriana and I stutter. What time do you close? And they say that 20 times to 20 different people. And then all of a sudden, this feeling that I can't express myself as a person who stutters diminishes. So these are important internal factors that we address before we talk about the mechanics. Talking about stuttering is really, really difficult for people who stutter. There's a lot of shame. That last drawing that I showed you, the person lying on the table, shame and embarrassment and fear. So the desensitization piece of my program is very, very important. And then this doesn't happen in a ladder kind of situation. We begin with one thing and we incorporate it into the next. So motor retraining activities is the next step, if you will, in the program. And we're teaching people how to begin voicing so that they don't lock up, so they don't have all that tension. So the behavior is called an easy, relaxed approach. And it sounds something like this. Apple pie. Yesterday. My name is Adriana DiGrande, as opposed to my name is Adriana DiGrande. then that's what happens in stuttering. It usually happens at the beginning of a sentence, but not necessarily always. But definitely the beginning of a syllable when it occurs. So whether the stutter is at the beginning, the first syllable in a sentence, or the first syllable in a word somewhere within that sentence, there's still tension at the beginning. So this easy, relaxed approach teaches our clients to ease into that first syllable. And then the rest of the syllables flow. It's pretty amazing. After we start out, I have a hierarchy that I use: a single syllable word, multisyllabic words, sentence, conversation, reading, and they're practicing this across all those different settings. And then a couple more things, and I'll end here. We teach clients when they do have a moment of stuttering, despite using those strategies, they can learn to pull out of that moment of stuttering rather than struggling through it. And struggling through it is what happens to many people who stutter. It takes a lot of time to replace that urgency to move forward despite what your body is telling you. The vocal folds are locked and you push through that feeling of tension, you'll just continue to stutter and stutter. Your stuttering persists in that moment. So if I said, my name is Adriana, that's overlearned. I've done that all the years of my life. A client might say to me, I don't stutter, but I've learned a lot about it. So we teach our clients, as soon as you feel that little tension at the very early onset, release it and ease out. Hi, my name is Adriana DiGrande. What time will you be going to work today? So instead of struggling, working with the moment of stuttering. Sounds easy, but it's very challenging to do. And then we talk about attitude, not being fearful. How do you go from an avoidance state to an approach set? An approach set meaning take as many opportunities as you can to practice your behaviors. Telling people about your stuttering. I had a young man who worked in one of the finance programs or finance buildings in Boston. And he completed my program, and he did this wonderful thing all on his own. He sent an email out to everyone on his floor. There must have been 100 people at his level. And he sent an email out to everyone, letting them know that he stutters, that he was completing a program for people who stutter, and that they will hear him speak differently when he returns to work. And he said that because he said, I'm telling you this because I want to feel comfortable when I come back to work, and I don't want you to wonder what happened. He left work 3 weeks ago, and now he's coming back with all that stuttering. So I thought that was very courageous on his part. And what he received was lots of emails from people who supported him. So being open about stuttering is challenging, but the outcome is wonderful. And it really does help people feel better about themselves and their speech and be more open. And then the final step is transferring these skills on the telephone, with friends, family members. And then once they're at the transference level, then it's really time to just let them go and be on their own. And of course, people will always check in with me. I get letters from people that I worked with literally 20 years ago. And I see, John Smith, I remember him. And John is just letting me know where he is in his life. That is such a wonderful feeling to know that 20 years later, you're still helping someone change some very important parts of their lives. So that's my program, and it's just a very small or simple
Very,
explanation or description.
that's great though. Very impressive. One
Yeah.
question I have while you talk: is this? It sounds like it's like 3 weeks full time to go through this process.
Mm. It was 3 weeks when I was doing the intensive program. So a 3-week program is really about 100 hours of therapy, if not more. So it's every day, 3 weeks, 7 hours a day, home practice. Now the practice that I'm doing is more individual. And I should have retired a few years ago, but I decided I cannot retire. It's like Al Pacino. They keep rearing me back in. Remember that from, I think it was The Godfather. But in any case, so I'm not running the intensive programs, but I am seeing people on an individual basis. We go through all those steps. It takes much more than 3 weeks. People are usually in therapy for several months, sometimes more.
Okay.
It's my hope to give them enough information that they can take it and continue.
Yep. Yeah. Oh, that sounds great. You've brought a video with you, so do you want to introduce that, and then we can run it from here?
What you're about to see are a set of two parents of a child who was 7 years old, I believe, when I met him. And they're going to talk a little bit about their experience in therapy and with their child. He was a terrific young man. He was awesome. So you won't see him, but you'll see his parents talk about him and their process and what they needed to do to help their child recover from stuttering.
Okay. Yeah, we can run that video now.
Our son Dean started stuttering pretty young, actually, but every time he'd start stuttering and then it would go away, and we would talk to his pediatrician, and his pediatrician would say, that's what happens when a child's speech grows. And we would say, okay, and calm down. But then the summer before first grade, it got really severe. There were bumps, there were blocks, and we got really concerned. We had a speech pathologist friend. She worked with Dean and then told us that we really needed to find a specialist. At the same time, we were Googling, we were trying to figure out what we could do. And there were some people that were saying, this is who your kid is, embrace it. But then we found Adriana DiGrande, and she was a godsend.
Yeah, we were up many nights just stressing over, our kid who had gone from being super dynamic to feeling like he really couldn't express himself in the way that we knew he could, and was, not speaking as much and going through first grade. It was a real big challenge for him, both academically and also socially, because he wasn't his true self. And we are just so grateful forever and always that Adriana DiGrande had an opening in her schedule. From the minute that we met with her, our nerves calmed. Dean felt super comfortable. They talked about speech. They played fun games. We met every week over Zoom, Dean and myself and Adriana, to go over different skills. And it was really trying to teach Dean to speak again and to get the confidence. So it started with one word, and then we moved to 2 words, and then we moved to carrier phrases and full sentences. And in addition to the sessions once a week with Adriana, we worked every single night for 10 minutes. And so what that meant was, if it was a game and we were doing 1 word, it would be 1 word smooth, and making sure that he could do that 1 word smooth. And then that built up to 2 words smooth. And then that built up even more. And so we just, in addition to the language growing, his confidence grew with it. And I think within about 3 weeks to a month, his teachers started saying, oh my goodness, who is this kid? This is incredible. He was just really coming out of his shell and able to express himself in the way that he wanted to. And we committed and stuck with it for 9 months of working every single night and meeting once a week with Adriana. And after those 9 months, Dean had earned his Smooth Speech Trophy, which for a kid who loves competition and works really, really hard, it is by far one of his most prized possessions, because when he sees it, he knows how much he earned it for the hard work that he put in. And, I would just say that if you're in a place at any place during this progression that we've been through, just know that there's resources out there. I mean, we were scouring the internet, and our friend had suggested this, famed Adriana DiGrande, and she absolutely delivered in every way possible. She's someone we treasure as still to this day. And Dean's someone now who, he volunteers to speak at his all-school assemblies in front of the entire school. He was selected to do the school announcements one morning and over the loudspeaker, and his teacher told him it was the best one she'd ever heard. And even today, he was in a ceremony where he had to speak and sing in front of an audience, and he crushed it. And that is just who he is now. We all have some bumpy speech, but Dean is a smooth speech guy, and we're so proud of him and so grateful for the resources and support that's out there. So we encourage you to seek that out as well, and know that there's a pathway for your kid.
Well, we're back. So that was quite a video. I do have a question for you. Are you open to being cloned?
Well, that's a good question, because I am in the process of cloning 3 of my young clinicians that I trained at Emerson College, and who are also now moving towards specialization. So yeah, I'm trying to clone as many as I can.
Oh, that's great. It's just such a powerful video, and just nice to hear from people that appreciate the work you do. So I guess we're sort of coming to an end here, but I just had a question, and I don't know if this is a valid question or not, or if you'd be able to answer it. It's like, what do you consider success at the end of your program, and what do you think your success rate is, and just any stories you want to tell us about that?
Yeah. That's a really good question, and it has changed over the years in our field. So when I started, it was all about the percentage of stuttering at the beginning, percentage of stuttering at the end. So that would demonstrate success or non-success. As our field has grown, I believe that's part of it. We want to reduce those behaviors so that people can say what they want to say. So the frequency of stuttering is, in my mind, is part of the success. But also those covert features. In other words, is the person talking more? Is he, as the young guy that you just heard about, is he participating in school? Is he volunteering? Is he saying what he wants to say? How does he feel about himself? So it's now that integrated assessment. How is that person? You could have a person speak fluently by using some strategies, but still stay quiet because maybe they don't like the way they sound when they use those behaviors, or a number of factors. So now I think as I said a minute ago, is it's really important that not only does the stuttering decrease, but also the attitude and the willingness to communicate. But I have a drawing that I do want to show you that's different from the others. So I'm going to share my screen, if that's okay.
Yep.
And I'm going to share that little picture with you guys. So this was one of my favorite drawings, because this is, believe it or not, a child who was, I think, 9 or 10. She was from the Middle East when she came to the program. And this was the picture she drew of herself before therapy. And this is perfect. And what she writes here is, this is an analogy, 10-year-old, this is an analogy of my stuttering. The mouse represents my speech muscles, and the cats represent my mind ambushing and pressuring my speech muscles. That is incredible for a 10-year-old. So this is stuttering. And stuttering is you can't say what you want to say, and that you believe in your mind that you can't. You're going to be laughed at, teased, whatever. And then at the end of her program, this was her drawing. And here, the mouse represents my speech muscles relaxed, and the cat represents my thoughts relaxed. So they're at the beach drinking cocktails. So
At 10. Okay.
that to me, unbelievable. It was just really very, very sweet. And then I also thought that this might be helpful. This is comments from a teenager. And this is what she says. I have been working with Adriana for several years, and it has helped me so much. She has taught me many strategies for managing stutters, while also helping me become more comfortable with my stuttering. Adriana has helped me to combat fear of speaking and to implement the strategies I learned in my everyday life. I've gained so much more ease and confidence when speaking, and I will always be grateful for the wonderful experiences I've had working with her. And I know some of this is too much about me, but she says a lot here about her changes and where she's at this place. So that's how I would rate my success rate, is where's my client at the end of our process? Are they feeling comfortable? Are they saying what they want to say? Are they feeling like they have a role and they can communicate? So
Yep. Yeah, I understand.
in the past, my rating of just the stuttering itself would always be about between 80 and 90% of my clients. But it was basically on looking at the frequency of their stuttering. And now being a little wiser, it's looking at the ABCs of stuttering: the affect, the behavior, and the cognition.
Yeah, that's really great. It sounds like it's been very successful. That's about all that I have right now, Adriana. So, anything else you'd like to add before we sign off, or?
No, there isn't. I appreciate having the opportunity to come to your program and talk a little bit about my work. So thank you.
Oh, and thank you for coming. So, we're now at the end of this episode, and I want to thank my guest, board-certified specialist in stuttering, Adriana DiGrande. Her website is stutteringtherapy.org, and Don Hart of the Hart Speech Foundation. His website is Hart, H-A-R-T, speech.org. And if you want to learn more about the Speech Foundation, it's available on YouTube. You can do a search for Hart Speech, and you can see the first episode that we generated here. So we do have plans for one more episode in this series. We will be here along with Dr. Tumanova of Syracuse University to talk about her research into childhood stuttering. She's looking at the mechanics of it and why some kids outgrow it and others don't. But, so we'd like to thank you for watching this episode, and I hope you found it interesting. And if you know of anybody that stutters, please share this information to them. And again, I hope you found this very interesting, and thank you for viewing.
Thank you, Frank.